I called 911 when my grandmother had difficulty breathing. I accompanied her to the emergency room and was devastated to learn that my grandmother was diagnosed with congestive heart failure. When loved ones are in the hospital with medical conditions so severe that it almost takes their lives, it can be difficult for family members to know what the dangers are. When my grandmother was sent to the critical care unit due to shortness of breath and gastrointestinal bleeding, I was left to be her primary caretaker. During her hospitalization, I was appointed to translate on my grandmother's behalf in all interactions with health professionals. And during those interactions, I found out she was diagnosed with congestive heart failure. Today, I would like to inform you about the dangers of CHF, also known as congestive heart failure, a chronic condition or type of heart disease. In my speech, I will be focusing on these aspects of congestive heart failure, which are what congestive heart failure means, its dangers, and identify the most common symptoms, the causes of congestive heart failure, and the treatments available for congestive heart failure. Let us start with dangers of congestive heart failure. First, what is congestive heart failure? Congestive heart failure is described as a chronic condition or a type of heart disease when the heart does not pump blood as well as normal. The dangers are the conditions that lead to the symptoms. What are symptoms? Symptoms are described as subjective indicators that have been complained about by a patient about a medical condition or disease that they're experiencing, which is different from a sign or indicator. Some common symptoms as they pertain to congestive heart failure are shortness of breath, edema in the arms, legs, and ankles, and increased urination at night. Shortness of breath due to congestive heart failure can happen for several reasons. Difficulty breathing due to the buildup of fluids in the lungs. The buildup of fluids in the lungs happens because the heart muscle is not strong enough to pump adequate blood out of the heart, which can cause blood to back up and push fluid to accumulate in the lungs. And bacterial infections such as pneumonia. According to the American Journal of Cardiology, Dr. Irvine H. Page once said, "The central problem of heart failure is not that patients are short of breath or that they retain fluid, but the problem is that they die. Heart failure is a mortal illness, more serious than most malignancies. Thus, what people eat can worsen the conditions of CHF, such as drinking excessive fluids will cause more fluid retentions in the lungs. Consuming foods high in salt content can also be damaging as it increases blood pressure. And consuming alcohol can strain the heart and the kidneys." One of the leading causes of congestive heart failure is hypertension. What is hypertension? Hypertension is also known as high blood pressure. It is one of the leading causes of congestive heart failure and plays an essential role in understanding the disease. Hypertension is a major health concern and it affects certain age groups, especially those who are 60 years and older. According to Marin Health, Dr. Osler once said, "The way to lead to a long life is to get a chronic disease and take care of it." We may not be able to prevent the cause of high blood pressure, but we can take care of it as we get older. To this day, high blood pressure is the number one killer among diseases. According to the American Heart Association, heart disease such as CHF have already claimed 24 million deaths of Americans if their projected lifestyle stays on the same path as it is on now. Health conditions of CHF can continue to get worse as people get older, based on how they treat their bodies with age. Studies have shown that habits begin from an early age as you continue with your life into adulthood. People live from their upbringing can impact the foundations of their bodies. Risk factors include using tobacco products or drinking alcohol, having a sedentary lifestyle, having coronary artery disease, or having a heart attack. In the case of congestive heart failure, a reason this could happen is that high blood pressure can cause a lot of pressure in the heart, and therefore force the heart to work harder against the pressure in the artery, which will eventually damage and wear out the heart muscles over time. As a result, that would lead to congestive heart failure. For example, one factor that would raise high blood pressure is eating foods that have a lot of salt in them. Another factor that can contribute to high blood pressure, which can increase the risk of congestive heart failure, is eating foods with lots of fats, such as LDL, which is known as bad cholesterol. How does a sedentary lifestyle affect congestive heart failure? According to the American Journal of Cardiology, the author Dr. Cheyenne Kirshen once said, "Our data supports the idea that it is better to sit less and more and move more to reduce heart disease risk," which leads to the idea of the importance of staying physically active and dieting. First, the main cause of congestive heart failure is having a sedentary lifestyle, which leads to obesity, diabetes, and heart disease. According to the Cleveland Clinic research, studies have shown that obesity consistently demonstrates a strong connection to increased risk of heart failure. The other factor that can contribute to obesity is lack of dieting, which includes consuming foods with more calories than you burn. Consuming too much sugar is more than your body can absorb, a hormone known as insulin. And a lack of exercise leads to the buildup of clogged arteries from the accumulation of plaque, which leads to high blood pressure. There are also other causes leading to congestive heart failure, such as chronic stress. Therefore, it could be many factors that lead to stress, such as long hours at work or heavy workload for an extended period, and conflicts with family or relationships. Exposure to toxic work environments can lead to depression or even burnout, which damages not only your physical health, but also your mental well-being as well. According to WebMD, the author has stated that there is no cure for congestive heart failure, but there are other treatments available to help manage the symptoms and mitigate the risk of CHF. Treatments for congestive heart failure can be broken down into 3 categories: lifestyle changes, medications, and surgery. I will be discussing lifestyle changes for treating CHF. The most common ways are limiting salt intake to less than 22,000 milligrams per day, limiting food intake to prevent buildup of fluids in the lungs, and exercising daily to reduce buildup of plaque in the arteries or the risk of coronary artery disease. Medications are another form of treatment, which is the most common way to manage the symptom. And they are diuretic medications, which help remove excess fluid from the body. Beta blockers that lower blood pressure and heart rate, which puts less pressure on the heart. Medical devices and surgery can be an alternative form of treatment that aids with medication, and they are pacemakers that can help keep the heart in check and by regulating the heart and its rhythm. Ventricular assist device, which are devices that can help pump blood in the heart if it is not adequately pumping enough blood. If all methods fail, depending on the age of the patient and the severity of the condition, surgery would be the last resort, which would involve heart replacement. Now we know how to identify the causes, symptoms, and treatments of congestive heart failure. In conclusion, I hope I was able to clarify that there are many ways that will help make a substantial difference at managing congestive heart failure, such as dieting, exercising, and taking medications as prescribed. I believe congestive heart failure is an important disease to know, and simply having awareness of maintaining a healthy diet is important. Next time a loved one is experiencing a certain symptoms, these are the key things to look out for and to manage the symptoms. As they always say, healthy habits today will lead to a healthy heart tomorrow. Thank you for listening.